Good morning, ladies and gentlemen. I am Helen. I hail you coming from Baptist College of Theology, Oyo, an associate professor in Nigeria. The title of my paper is Integration of Family System Theory to the Management of Dysfunctional Relationships, Christian Counseling Approach. You will all believe with me that the recent experience of hardship, boredoms, have affected different kinds of relationships one may have. There exists a lot of bad reports of disunity in the family, among friends, in the working place, among Christian groups, and very glaring in the church. There are also no response to one another's welfare and a lot of misunderstanding from the family to church groups to societal groups and everywhere. To the extent that the companionship and friendship one was once proud of has now lost its value. Family, friends, and church relationships that have been source of joy, support, and love have become source of pain, conflict, and dysfunction. Dysfunctional relationship within families can have a profound impact on individuals. It can affect one's emotional, mental, and spiritual well-being. This paper explores the application of Christian counseling approach with a focus on family system theory to manage dysfunctional relationship. Dysfunctional relationship, the understanding of dysfunctional relationship is very, very important in this paper. It has been said by Strom that a dysfunctional relationship include a series of harmful practices that become the order of the day between partners. A dysfunctional relationship is equally a connection characterized by persistent patterns of unhealthy behaviors and emotional distress and a lack of support of fulfillment. This may lead or may involve destructive or harmful behaviors that are repeated over time, which may lead to power struggles and conflicts rather than mutual support and trust within the family or within a group of people. This relationship that is toxic in nature impede positive growth and constructive interaction. Bufamano stressed that dysfunctional relationship is characterized by unhealthy patterns that have a direct impact on individuals' mental and emotional well-being. And how do you identify dysfunctional relationship? There are three major features that you can look for. One is codependence, excessive dependence on others for emotional validation. Enmeshments, overly involved and entangled relationships. Conflict avoidance of conflict, which may lead to unresolved issues. There is need for us to um, know the causes and effects and maybe the consequences of dysfunctional relationship, because it is even the effects that is very glaring in our society now that makes this writer to see it as a problem to be addressed. Causes of dysfunctional relationships include individual factors such as unhealed trauma from past experience, low self-esteem, unrealistic expectations, and also relationship factors which include poor communication, power imbalance, and infidelity. We also have societal causes such as cultural and social pressures, lack of support system, economic dependence. Other factors are substance abuse, mental health issues, and lack of boundaries, poor boundary setting. And what are the effects of dysfunctional relationships? Dysfunctional relationship can have severe and long-lasting effects on individual. It can impact emotion, it can impact physical and mental well-being. The emotional effects include anxiety and stress, low self-esteem, emotional trauma, depression as a result of mental health effects, and post-traumatic distress, stress disorder. And majorly, it can have a lasting effect of suicidal thoughts in extreme cases. It can also involve chronic pain and sleep disturbances, which may weaken the immune system of an individual. We also have social effects, like an individual may decide to isolate himself, and it can lead to intergenerational trauma if left unaddressed. Uh, it can also lead to long-term effects, changing the personality of an individual totally. For instance, a very gentle, quiet person, easygoing, may become so aggressive in nature because of an increased anxiety in him or her. And it can also lead to physical health problems. What are the consequences? These involve decreased self-esteem, somatic symptoms, low motivation to get anything done, inappropriate priorities, and it may lead to learning to tolerate abuses, which is not good. Now, the use of family system theory in counseling. I have here how this theory is developed. Because of my time, I will not be able to read the explanation here now. In managing dysfunctional relationships, summarily, Murray Bowen has offered counselors, especially Christian counselors, a very simple way to understand this particular theory in order to help victims before they get to harm themselves. The counselor, through this theory, will be helped to identify those who have the problems, and they in turn will help an individual to understand that they have the problems of dysfunctional relationship. In the management, dysfunctional relationship that has bad side overweighing the good, we need to see a counselor and sit down together to firstly address or underline the problems that is strengthening the situation that the person is surrounded with, or the victims generally. And part of what to do is to get the understanding of the actual problem, then set boundaries and develop healthier communication. Communication, active communication will help a lot. Christian counseling approach using family theory is a process of increasing one differentiation and ability to balance automatic reactivity, associated subjectivity with a more factual view of oneself and others, which is applicable to any small or larger relationship. This Bowen theory is ridiculously simple if people can compare their pre-existing assumptions that have dictated their interactions with others with a different way of thinking. It may not happen overnight, but it is possible. This writer lean on the fact that the theory emphasizes that human beings generally have developed an intellectual system that has the potential to gain emotional objectivities about human interaction. Another way of integrating the family theory to deal with dysfunctional challenges is to understand and establish the competing needs and expectations that has compounded life inevitable stresses and generate chronic anxiety in relationship, as indicated by the theories. Anyone in venomous relationship is vulnerable to mental, physical, or social dysfunction. So it is necessary that the therapy include that the counselor should train and encourage the victims during counseling session the practicality of forgiveness and reconciliation. A family psychotherapist guided by Bowen theory tries to help family members and individual in toxic relationship to understand a way of decreasing chronic anxiety in oneself and in others. This approach also employs some biblical justification by this writer that is centered on being kind-hearted, tender-hearted, in forgiving each other as Christ has established it in Matthew 18:15 to 17, which provide guidance on forgiveness, reconciliation, and conflict solution. Recommendations. Because of my time, I will just mention two recommendations out of five. The victim should help to develop self-awareness and emotional regulation by attending counseling session regularly for at least 2 weeks, 3 times in a week, making 6 times of meeting. By the time the counselor and the counselee meet for 6 times, minimum of 30 minutes per session, the victim will overcome the problem. The Christian counselor should help the vulnerable to establish clear boundaries and expectations. Each person involved should be patient with others involved. Conclusion. Dysfunctional relationships can be transformed through the application of family system theory and Christian counseling approach by recognizing patterns, seeking spiritual guidance, and developing healthier communication. Individuals can experience healing, growth, and they can restore relationships. Thank you.